Hello, hi. We commonly get knee symptoms of pain and discomfort when climbing up or down the stairs. In this particular video, we're going to concentrate on climbing up the stairs. Now, this is specific for conditions such as arthritis, wear and tear in the joint cartilage in the knee. Now, we've got to be able to climb up the stairs because that's part of our daily activity. In order to carry out the task, putting too much load through the knee joint can create irritation, inflammation, and pain and discomfort. You may have commonly heard if you can strengthen the muscles around the knee, then you get less symptoms. We also need to look at joint motion and not just strength. So how is the hip doing? How is the foot and ankle working? If the ankle and the hip are working efficiently, then the knee joint doesn't have to take too much of the load. So here are some exercises with some progressions that you can do when looking at climbing up the stairs. Now, of course, because of the clinic, I'm at the top of the stairs, but you can do this at the bottom of the stairs to make sure that you're stable and that you've got some kind of connection to a wall or to handles or to a banister. First of all, we're looking at mobility, especially in the hip joint. This is really, really important to get the hip joint moving in this particular movement. So we start off with a very simple hand contact drill where we're just driving the knee forwards and backwards. Now here you're thinking about a rope pulling your hip forwards and backwards. So you're getting a bit of a stretch down the front of the hip joint there. It's a very light stretch, so don't expect anything too much. It's just a very light stretch as you drive your knee forwards and backwards. We also need to look at a side to side motion. So with the front knee forwards, you're just going to side to side, and this will just open up the groin on the inside of the hip as well. If you want a bit more of a stretch, just gently widen your stance if you've got some room on the step, and then do exactly the same thing. And here you're thinking about the rope pulling you off to the side as you're on that step. The last one is a rotational motion, and this is just to improve some of the rotation that we have in the hip joint. You might find that you get stuck in the hip and you're just using the body. Try to get the pelvis and the hip to rotate round the corner with this one, and even to the other side. So even to the other side, very gently. Now here you want to make sure that your front knee doesn't flick around to the outside, but your front knee is staying in this particular straight position, and you're just rotating over that front knee. It's okay if it moves ever so slightly, but where we don't want it to happen, what we don't want it to go is right out here. So that's just to get the hips moving. Then we're going to enhance the hip motion even more by using some hand reaches. Now, if you feel unstable, and of course you should do this at the lower end of the stairs and not up here at the higher end of the stairs, but if you do feel unstable, keep a hand contact on one hand and use just one hand through these exercises. If you're feeling quite stable, you can use both hands, and this is what we're going to do. We're going to reach forwards, and then we're going to reach up, forwards, and then up. You can change that into a bit of a swing motion, so you can take it forward but then swing up nice and tall, take it forward and then swing up nice and tall. That will get you to drive the hip forward. If you want to do single-handed, we just drive the single hand down and then up. If you've got a contact this side, then just dropping the left hand and driving it up nice and tall. So you're getting, again, nice stretch through there. The second one, do use a single hand for. So this is, you're going to keep one hand on the banister, but think about this hip and pelvis moving to one side. So one hand over here, the right hand if the right leg, left hand if the left leg is the one going over the top. And what we want to do is just drive that hand over the top and get that same side shifting, but this time we're getting the hands reaching with you as you do this motion. That's the second one. The third one is a rotational motion. I always tell my patients to keep a contact with this one and use the opposite hand in this case, so the right foot, the left hand, and all you're doing is driving the knee forward and just reaching round the corner over that hip to get some more mobility through the hip joint. Now that clears the mobility side, but we're also going to look at the strength side. So I'm going to do two levels for this, level 1 and level 2. Obviously level 2 will be a progression, just make it a little bit tougher. So with level 1, we're just looking to strengthen the knee, but using these muscles, the glutes, the hamstrings, and also all the way down to the foot muscles as well. What we can do for this is use our 3D motions again, our 3 directions that we've been just doing, but this time take away some stability. So usually we have at least one contact point on the stair. So if you do have a banister on this side or this side, then that's where you're going to keep the contact point. The other hand is going to be free, so you're taking off some stability. And what we're going to do here is use our 3 directions. And the first one we're going to do is our rotation. So it's just taking the opposite leg round to the right. So we're going to take the opposite leg round to the right and come back down again. Round to the right and come back down again. If this one is sore, then we've got 2 other movements you can do to start off with, but we need to be good at all 3 motions eventually to be able to get up the stairs without discomfort. So that's number 1. Number 2, we're looking at side shifting. So for this one, just bring the front leg just across your body, so you're just crossing it over, so the other leg is slightly behind you on the opposite side. And here we're just going to come up into the step but slightly side shift. Slightly side shift, so you're just pushing your body over to this side. Now what these are doing is these are generating strength in different muscle components. So for example, these ones you'll feel a lot more on the lateral side of your leg as you drive up. You can see that my back foot is still staying a little bit on the outside of this foot here, the front foot. So that's the second one. The third one is coming up into a forward reach. So this one we're going to put a little bit of pressure, reach forward, and then immediately come back. Reach forward, immediately come back. If you have 2 contact points for this one, you can do. For level 1, that's not a problem. So you have 2 contact points, you reach up and then you come back, you reach up and then you come back. You do 3 or 4 of those and you'll really begin to feel these muscles working. Now for the strength component, of course, I'm using specific stair exercises. You can do other exercises away from the stairs to help with this, which you may have been given from physiotherapy appointments or from other type of training, personal training, or people that you know have given you certain exercises for knee. This is specifically designed to help you to improve stair climbing. Now what you want to do with these 3 movements here is to find the ones that are least painful. Now I'm not saying they're going to be completely 0 pain, there may be some, but you don't want to aggravate it too much. So find the least painful positions. If all 3 of them have just a tiny bit of pain, not too much, then that's good. You can work through this and improve your strength and movement. If only 2 of them or 1 of them is pain-free, stay in that particular movement. Let's say, for example, these rotation ones are the ones that really feel good and you don't feel too much discomfort when doing that. Continue that and we can progress to level 2 even with that one. What you might find is as you strengthen one plane of motion, another plane becomes easier to do. So for example, maybe it's the side shifting one that becomes a little bit more easier to do and feels a lot more comfortable on the knee. From there we've got level 2 for all of those. So we start with the rotation ones. So with the rotation ones, level 2 is essentially taking contact points away. So now you're not really having the contact points and we can use our hands a little bit to get round the corner there and to come back, to get round the corner there and come back. Nice and slowly, nothing too fast, you're just coming round and then you're coming back. The second one will be foot across, the other one slightly across. Now for this one, the stability is important because obviously it's a bit wobbly. So I want to just maybe keep this hand in front of you or just above your head slightly to give you a bit of stability, and you're just rocking off to the side. You're just rocking off to the side. You've always got a contact point if you need to. And the last progression, obviously level 2, then we're coming to a straightened position, no hands, and we're just driving the feet up in front of you a couple of times and then coming back. Obviously you can toe touch if you want a bit more stability, and you've always got contact points to help you. As I said, please do this on the first step rather than the top of the step, because we don't want you to have that wobble and definitely don't want you to be falling down the stairs. So please do this downstairs. Just demonstrating here as it's easier for me to have the video camera in this particular area so I can show you what we can do. So hopefully that helps. Let me know if you have any questions. I'll be happy to answer them, and you can give us a call at any time.